Federal Minister of Health, Patty Hajdu, the Thunder Bay Superior North MP, joins Net News Ledger for an update. It's James with Net News Ledger. Joining us by Zoom is Minister of Health and member of Thunder Bay Superior North in the House of Commons, Patty Hajdu. Welcome back.
Nice to see you, James.
We have had a week here in Thunder Bay with COVID numbers climbing. We've got outbreaks at 2 of the schools. Maybe we need to be scolding people into, I don't know, what do we have to do to get people to get back to the numbers we had?
Well, I mean, this is a complicated situation, but not surprising. Listen, COVID is nothing about COVID surprises me, but I will say there are some characteristics that we know about the virus now. One, it loves crowded situations. So, when there's lots of people crowded together, poorly socially distanced, that's a great place for COVID to spread. And we have to remember back, just not even a few weeks ago, this recent round of COVID outbreaks started in the Thunder Bay District jail, in the local community jail, spread obviously to a whole host of populations. And as people get sick, of course, they interact with other people. They interact with family members. They interact with, in other organizations, other workplaces, and that presents risk to the community. So here we are now, a couple weeks after the reported jail outbreak, and we see it spreading into schools and spreading into other community groups, and the hospital filling up. This is not a new story. This is exactly the story that other communities have faced. When it gets into a congregate setting like that, it is very, very hard to actually put out, because unless you space people out really quickly, that virus continues to grow. And people don't live in bubbles. Workers have families, people interact with a variety of different places and spaces. So here's what we have to do now as everyday citizens. We have to keep buckling down. And it's a terrible message. Nobody wants to hear it. Nobody wants to stay home anymore. Everybody wants to start to resume their life. But if you don't have to go out, don't go out. If you can order your groceries in, order your groceries in. If you can, get takeout, get takeout. Try to make sure that you're staying home now, because obviously as cases rise, it really puts everybody's health at risk. And it only takes exposure, with someone who's mildly ill that may not even know they're ill. And that's the real sneaky aspect of this virus.
Through the whole year that we've talked about this, you've said so many times how sneaky COVID-19 is, and it really is.
It really is. I mean, there's asymptomatic transmission. We know that, there are people who are mildly ill. The symptoms can be vague. There's more symptoms now. We know more about COVID. It presents itself in a variety of different ways. You might have a really bad headache one morning. You might feel sort of under the weather and sleepy and tired. Those can be symptoms. And, you may have the full-blown cough and fever and aches and all kinds of other issues. But that's the challenge. There are people on the other end that are not feeling very sick. And that's why we've been asking people to really prevent going out. Because if you could know that you're only infectious with your coughing, that's a different story. But this is not that. This is a disease that is, in some people, so mild that they don't even know they have it.
Now, doing a little bit of a shift with things, the vaccine is our light at the end of the tunnel. There's been a lot of information coming out on it. What are the facts that our people in the readership here and the viewership need to know?
Well, first of all, in Canada, we have 2 approved vaccines, Pfizer and Moderna, both very effective. So in the 90% effective rate, which means that people who are vaccinated are way less likely to get sick and die of COVID. We know that the vaccine, we had the bump. Everybody's aware that we had a delay in the deliveries from both manufacturers. This was not pleasant for anyone and really, disappointing, I think, for Canadians across the country. But we're back on track. We received 400,000 plus doses this week from Pfizer, another over 400, and I think it's 40,000 doses next week. Week over week, Pfizer will be delivering numbers in that range to Canada, and Moderna as well has resumed deliveries. We'll be getting the remainder of their commitment by the end of March, and so this is good news. And so you can see, even in Thunder Bay, communities are ramping up to receive those vaccines and being able to broaden out a bit from the early priority groups. So if you remember, it was people living in long-term care homes, people working in long-term care homes, and healthcare workers. Now we're going to start to see broadening out to, older adults and adults with underlying conditions and other kinds of categories of adults that will be able to receive vaccination as we proceed. And so this is good news. We also have 3 more with Health Canada. AstraZeneca is very close to a decision from the regulators, so that's exciting. But Janssen, which is the Johnson & Johnson vaccine, they're also plugging along very well. And we're working closely with the EU, with the FDA to make sure we coordinate our data and we can share data and share understanding of each vaccine. So there is light at the end of the tunnel, James. It's just we have to get there together. And this recent outbreak from Thunder Bay is very, very concerning and puts lives at risk.
That's been the scary thing. What some of the good news, we get a lot of things from the Canadian Rangers who are assisting and helping with the distribution of the vaccine in the Northern First Nation communities, and they're doing an amazing job. There are good news stories there.
It's been that is a great news story. And as well in the northern provinces, so northern territories. So, I have to thank all the provinces and territories that agreed that all the 3 northern territories would receive Moderna and additional doses so they could get 75% of their population vaccinated as soon as possible. That's a real spirit of being Canadian, taking care of the most vulnerable. Those communities are very remote. But the same thing with First Nations communities. It's been a real partnership with the Anishinaabe Nation and others to make sure that we can get vaccines up there. Chief Graham Fiddler has been really amazing, worked really well with the province and with the federal government. And of course, it's a partnership. So we've got the province helping, we've got the federal government helping, and of course, the First Nations leaders themselves helping. So this makes a really smooth process. And it's great to see the take up, people willing to get vaccinated. Really, really good news.
A message for Thunder Bay, Superior North, and Northern Ontario.
Well, it's just listen. We are in a bit of a dangerous time here. This is real. This is don't I want people to see those numbers and see the fact that we've got school outbreaks and we've got a hospital that's growing in numbers rapidly day over day. I mean, we went from 3 people in the hospital to 12 people in the hospital. I'm not sure exactly what the numbers are now, but it's going to get worse before it gets better as more and more sick people get hospitalized. So what can we do to help? Well, we can protect ourselves, we can protect our families, and we can protect our healthcare workers and our healthcare system. Because if the hospital ends up getting so full, it means delayed surgeries, it means postponed routine treatment. It also means a lack of functioning in some cases for other urgent care. We only have one hospital for the entire district, the entire region. So we have to protect it.
Minister, thank you very much for taking the time today.
Thanks very much, James. Great to see you.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.